Johnston. I'm a pediatric resident at the University of Tennessee in Chattanooga. So today I'm going to be presenting a really interesting case following an undiagnosed presentation of Hydrops Fetalis. We have a patient who was born via emergency C-section at 32 weeks because of a premature rupture of membranes and non-reassuring fetal heart tracings to a 20-year-old G3P3 mother. We had no indication through her limited prenatal care that there was any hydrops involved. So that was kind of a surprise during delivery. Of note for this mom, her pregnancy was complicated by a limited prenatal care and multiple sexually transmitted infections. Her first trimester screens were all negative, but she did come into the ED and was treated for chlamydia and trichomonas. She had what they thought was a primary herpes outbreak, and she was treated at that time for it. At the time of delivery, it was kind of a surprise in the delivery room. The baby was found to have Hydrops Fetalis and severe respiratory failure. So she was intubated while in the delivery room. Her APGARs were 2, 4, and 7 at 1, 5, and 10 minutes, respectively. So initial findings include a really bad respiratory acidosis, along with a monocytosis seen on her CBC, very profound coagulopathy with an INR of 8.8, and then a direct bilirubinemia of 1.5 milligrams per deciliter. In some of the pictures, you can see the baby also had a really pronounced rash on her hands and her feet. And ascites as well as pulmonary edema. So originally they thought that this was a sequela from her HSV primary infection. And they had started acyclovir and treated for that. But as they kind of went on in her course and they were continuing to look through her labs, it was found that she didn't have any third trimester prenatal screenings. So even though her first trimester screening was negative, they did go ahead and retest for syphilis, which was positive. So this baby was interesting in the fact that they had Hydrops Fetalis from syphilis as well as the liver failure. But what is additionally interesting is after they got treated with penicillin and went through that, their bilirubin continued to climb. It went from the 1.5 to a total of 42 by 30 days of life. Excuse me. So it was the highest that most of our providers had seen. So what happened was they were treated with TPN and D10 cycling with omegavin for the first 30 days of life because she had difficult with feedings. And then once she was on full feeding, she was transitioned to ursodiol and continued taking that until she was about 3 months of age, when she was discharged from the NICU. I just followed up on her today, and I was able to find out that she was finally had a normal direct bilirubinemia after 7 months of life. So it took a lot of different treatment, and even though that she was treated for the infection, she had continued sequelae for this. The main important things about this case is to remember that even though Hydrops Fetalis and hepatic failure are really rare sequelae of the congenital syphilis, they do occur, and they should remember to be treated because this is a treatable condition. And if untreated, congenital syphilis has a 40% mortality. Also remembering that syphilis has a huge rise in the US. Over the last 5 years, it's increased by almost 300%, and with a continued increase of almost 30% in just the last year alone. And congenital syphilis are kind of showing those rises as well, up to 77.9 in the 2001. And another thing to keep in mind, and what's important about this case, is that first trimester prenatal labs are wonderful. We should definitely get them and treat accordingly. But when high-risk individuals, it's equally as important to treat during the third trimester and repeat those prenatal labs, because we can definitely have false positives and we can acquire sexually transmitted diseases throughout pregnancy. And this is the best example of that. So I was able to follow up on this baby, and they're doing fairly well, but if untreated, I think her course would have been much different. So I will open up to any questions.
Yeah, thank you so much, Brittany. We do have one question, and that's going to be they're curious what formula the baby started once she was able to tolerate enteral feeds.
So she was actually, um, that's a great question. I know she was discharged on like just a normal formula with the ursodiol because her direct bilirubin was so low. I might have to go and check and see exactly what she was started on.